Netcasts you love.
From people you trust.
This is Twit.
This is Twit Live Special number 293, recorded July 19th, 2016, Wearable Tech Conference, San Jose. Here in the Silicon Valley, the Internet of Things and wearable technologies are two catchphrases. Promises of profit, promises of future technology, promises of a vision where data is everywhere. But are those just promises? Are those to be unrealized realities? Are we actually going to see a revolution in wearable technology and the Internet of Things? I'm Father Robert Balaser, the Digital Jesuit, and that's why we're here in San Jose for Wearable Tech Conference 2016. One of the most promising areas of wearable technology and the Internet of Things is medical. What happens when you have a device that can monitor your vitals 24/7? What happens when you have devices that can find diseases before, well, they occur? That's why we're speaking with Daniel from Dr. Chrono, who's going to explain why the IoT is really the IOMT. Daniel, what is Dr. Chrono?
Dr. Chrono is a mobile medical record platform for doctors and patients. We have close to 93,000 physicians signed up for Dr. Chrono and over 6 million patients signed up for Dr. Chrono. So that's roughly 2% of the U.S. population that's actually in our medical software, which is this right here.
This is something that's been a long time coming because one of the promises of wearable technology has been that the various bands and bracelets and shirts that you can wear to collect data would eventually lead to healthier lives. That promise has been, well, a little lacking in the fulfillment because the data is so disparate and the devices are so different. What have you had to do in order to consolidate that and turn the data into something meaningful?
Sure. So we sort of curate the actual devices that go into the medical record in Dr. Chrono. So you can see here we have Dr. Chrono on the iPhone and on the iPad here. We also have it on Apple Watch. But what we look for partners to build on the Dr. Chrono API are companies like Echo Devices. This company actually built a Bluetooth connector that's FDA approved by that connects. You can pull a stethoscope apart, pop this device on, and the Bluetooth actually starts streaming your heart rate to the medical record, which actually the doctor can look at later on and see things like heart murmurs, and also send that to the patient. So say that there's a patient with a heart murmur, the doctor can actually review that and say, here's what it looks like actually in audio file, send that to the patient, and they have it for their life. Super powerful.
And that's one of the things that we were promised when we first heard about medical technologies, medical wearables, and medical Internet of Things. But tell me, what are the privacy concerns? Because anytime you start getting into health, you start getting into HIPAA. You start talking about data that must be kept secure, that can be shared with patients' permission, but should never just be out there. Does that make it a little bit more difficult to develop a comprehensive Internet of Medical Things software?
You always have to be a little cautious. So I sort of bucket it into two different areas. One is non-FDA approved devices. So that's like your Apple Watch, where you have your data coming in as a patient. The other bucket that I see is the FDA approved devices. So those are things like blood pressure cuffs, for diabetic patients to take the diabetic readings, for babies, taking a temperature to make sure that if they're having a fever. Those sort of things you want to just make sure are FDA approved, which means there are HIPAA regulations where the physician can't share that data, but they can also, the benefit of the FDA approval allows the physician to make a decision, a clinical decision for that patient. So there's some upsides and there are some downsides. So if it's the patient gathering the data themselves, the device doesn't necessarily have to be FDA approved. It's when you bring a clinician in that's making a decision. That's where it's a higher bar, but it's also a good thing because the doctor can actually use that to decide and make a decision for the patient. Meanwhile, there's a lot of data out there for these devices that you can walk around with and you're walking and all of these different sorts of things. But there's so much data coming at the doctor that they are sort of overwhelmed. So that you kind of want to curate the FDA approved devices and say, here's data that actually you can use that is interesting to you, right? So
In line with that, what's the end game for Dr. Chrono? Do you want to be in every doctor's office, everyone's mobile device, every tablet, every phone? Do you want to be tracking every last bit of data about my health? Or where do you see success?
I think success, if you think about the 1800s, the physician used to be able to walk around and see patients and go room to room without them actually having things get in their way. A lot of doctors today see the technology getting in their way. Have you ever heard of a cow?
Like moo?
Not that cow. There's actually something called a computer on wheels. So in hospitals, they have these big things that they sort of push around all over the place, and they call that a computer on wheels in the hospital. So the physicians and the assistants all say, let's go get the cow. It literally slows them down, and then instead of me taking care of you and taking care of the patient, I turn away, I start typing and looking at this, not even interacting with you and not taking care of the patient. Right now, sort of the technology is getting in the way. I think the long-term vision of our company and the Internet of Things, healthy things, is to allow the data to be collected, allow the doctor to do their job, allow them to get up, walk around like with an iPhone, enter data very quickly in a really simple way, not having them spend extra hours doing additional work, but also giving them insights into the patient. Imagine being a doctor and seeing 30 patients a day, and then once you're done with your day at 5 p.m., there's a pile of paperwork that you also have to do. That's what's happening today. So if we get the medical record down to this elegant solution and allow all this data to flow in that gives you insights, that's the vision of where we're trying to go.
Daniel, thank you very much for speaking with us. This is a very bright future for medical technology in regards to wearables and IoT. If they wanted to find out more about Dr. Chrono and what it might be able to do for them, where can they go?
drchrono.com is the best place. You can type in iPad EHR, that means electronic health record, on the web, and we're the first ranking.
Daniel, you were a speaker here at the conference, and obviously your technology is fantastic. Thank you for speaking with us, and you heard it here. Dr. Chrono, your best alternative to having a cow.
This is Twit.